Screening wildland firefighters for risk of heat-related illness can be quite complex. However, providing information about predisposing conditions can be life-saving. Subsequent actions can be taken to prevent a heat-related illness from occurring. Risk factors for heat-related illness can be divided into environmental and non-environmental. Environmental risk factors include wet bulb globe temperature, which accounts for outside temperature, relative humidity, air motion, and radiant heat from the sun. Monitoring the environment is critical to identifying times of high risk for heat illness so that wildland firefighters can be monitored closely. Heavy equipment and clothing minimizes the evaporation process and can cause greater absorption of radiant heat. Working in high-risk environments can create a cumulative effect of heat exposure, increasing the risk for a heat-related illness. Non-environmental risk factors include how well the wildland firefighter has acclimatized to the environment and workloads. Typically, 10 to 14 days is recommended to allow acclimatization to occur, which allows the body to cope more effectively to the environmental thermal stressors. Working at high intensities increases physiological strain, ultimately increasing heart rate and core body temperature. A rapid rise in temperature exceeds the ability of the body to dissipate heat effectively, increasing risk for heat-related illness. Other factors that may contribute to heat-related illness include poor physical fitness, increased body mass index, previous history of heat illness, and current illness because of fever or medications that may exacerbate risk. Dehydration occurs rapidly in a high-risk environment, so ensuring that adequate hydration occurs is critical. To assess your risk of heat-related illness, if you answer yes to any of the conditions listed on this slide, you should consult a healthcare provider to determine the appropriate course of action.